Good evening, I'm Deborah Pinkerton. Tonight, Penn State Health specialists are here to talk about keeping your bones and joints healthy. In the United States, there are about 7 million orthopedic surgeries performed each year. An estimated 12 million individuals between the ages of 5 and 22 suffer a sports-related injury each year. In older adults, bone and joint diseases are prevalent in nearly 20% of the population. Doctors will answer some very important questions tonight, like how do you know ankle replacement surgery is the right treatment plan? What are the latest treatment options for ACL injuries? And how can you prevent bone and joint injuries? And if you have questions at home, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hi, Deborah. Dr. Sarah Black, foot and ankle orthopedic surgeon at Penn State Health, is answering your questions tonight live on the web chat. She's going to be here until 8 o'clock. To submit a question, go to abc27.com/ortho, and I'll be back later in the show to share some of those questions with you. It's back to you now, Deborah.
Thank you, Donna. A Lancaster County man lived in pain for years. Ankle pain, that is. Bob Hershey was always looking for the next place to sit down. Here's Bob's journey. Bob Hershey is a collector.
I've always liked cars, so I grew up playing with cars.
A passion that Bob cultivated throughout the years. Now at 71, Bob's hobby has expanded into this.
I call it his garage mahal just because he has spent so many years on it, and it's very large, and he has a very large car collection.
I build some nice cars up there, and then I collect antique cars too, but mostly I build some pretty fast hot rods. Then that led me into enjoying these porcelain, tin, and dealer signs.
Bob's favorite pastimes took a back seat. His health became his priority.
In early 2000, around that time, even maybe the late 90s there, my ankles were starting to give me a bad time. They would turn over so easily and things like that. And I knew they were weak, but it just kept getting worse.
The diagnosis, osteoarthritis.
The pain that is associated with, ankle arthritis is great, and it's continuous, whether you're on the foot or off the foot. We live on a farm. At that time, we had an extensive business here on the farm, and it involved him being mobile to go all over the farm. So it ended up that mostly he lived his life on a golf cart.
Bob and Doreen talked about the next steps, including ankle replacement surgery.
My wife and I started researching and knowing that these were not going to last that long.
I was so grateful when the internet really came out, because that is actually how we found out about the agility ankle.
I sincerely would have gone anywhere in the world to find the best person to do that, because it's such a delicate operation and not many people were doing it. We heard about Dr. Paul Juliano at the Hershey Medical Center, which is 45, 50 minutes from me. And here I am willing to go anywhere, and found that the best guy was right there, the best doctor.
Initially, Bob went the non-surgical route.
So I visited Dr. Juliano, and he gave me special braces that we had inserted in boots and so forth. And it worked, and it helped. I clanked and clattered around with them for a while.
We spent a couple of years with him. He helped us do everything to prolong the replacement, because we were obviously hesitant.
After a couple of years, Bob could no longer put the brakes on surgery. In 2007, he had his first ankle replacement surgery.
At that time, there was one ankle available, one model, I'm going to say. So that's what everyone in the industry was using. And again, I'll say there just wasn't that many people doing, many doctors at all doing it.
Then the recovery began.
It was probably 3 months till I was really getting around on crutches and so forth, but gingerly and carefully. And 5-6 months I was still on crutches, but most of the time, but was relieving the crutches a little bit.
When the x-ray showed that the bone had grown the whole way tight around the replacement, he was able to start walking. And the first thing he said was, I should have done this years ago.
Lo and behold, I was out walking and enjoying it, pain-free.
3 years later, Bob had his other ankle replaced, this time with a newer model.
Then when it was time for the second one, we were not as hesitant. We were not afraid. We had complete faith in Dr. Juliano. By that time, we had known him 7 or 8 years.
It was a faster recovery. Still a lengthy recovery, but definitely a faster recovery. I remember I was on my feet earlier.
16 years later, Bob is still on his feet and is pain-free.
He has been able to return to a wonderful life for a healthy, active man, which he is.
I'm able to do all those things, to be able to walk and, go up and down stairs, be up in my shop, get in and out of the cars nicely and so forth. If I want to go and walk through trails through the woods, I can do that. So it doesn't really inhibit me at all.
So I'm so thankful to Dr. Juliano. Our life is so wonderful. We have taken trips to Europe and we have taken trips to Mexico, and we couldn't have done any of that.
That's good. I get around well, and again, so grateful.
And Bob encourages anyone with ankle pain to do something about it and don't wait. The surgeries, as you can see, really gave him his life back. And joining us right now is Bob Hershey and Dr. Paul Juliano, foot and ankle orthopedic surgeon at Penn State Health, and also Bob surgeon. Thank you both for being with us.
It's a pleasure.
Thank you for having us.
Dr. Juliano, how common are ankle replacement surgeries?
Well, they're a lot more common than they were in the past. When I did my fellowship 32 years ago, we didn't even do them at the time. So now they've become, as you can see, upgraded and more popular and state-of-the-art. But ankle arthritis is not as common as hip or knee arthritis, so you won't see as many people with that, but it's certainly a viable option. The name of the game in orthopedics is to restore function and restore quality of life. And that, I think, is what we strive with our mission statement and why we do it.
Yeah, and you have done that for Bob. You got your life back.
Oh my, yes. Oh yeah, it was. I was always looking for the next place to sit down. Just prior to that, and of course the pain was a major factor. So, when I went up to Hershey Med and met Dr. Giuliano, he made me feel pretty comfortable about moving in that direction. And it did give me my life back. I'm back up in the shop playing with the cars, and my wife and I she likes to go to wineries, so we do that on occasion and so forth. But yeah, it really did. It made my life so much better.
Yeah, I can't imagine being in that much pain.
Yeah,
and
it was painful.
Yeah, and Dr. Juliano, how do you work with the patients to really determine the best treatment option?
Sure, I think that goes without saying that with every patient, you establish a bond and you figure out what their goals are, what their needs, and you can match your surgical goals with their needs. So in the case of ankle arthritis, sometimes it's just a brace, sometimes it's medication, sometimes it's an injection, but when it gets to be the end stage, then you have to make a decision whether it's a fusion or a replacement. And the indication to do both of those to relieve pain. But in Bob's case, he had arthritis in both ankles, so the best option is to have a replacement at least one, but in this case we did two, and we upgraded from one side to the other.
Yeah, and certainly made a difference. And Bob, now you have developed a really good relationship with Dr. Giuliano. How important is that, to have a good relationship, to trust your doctor?
Well, when I researched it, and with the help of Dr. Giuliano, I realized how delicate and how major this surgery was. And so he was just great in helping me decide, gee, are we going to fuse this, or are we going to actually do the ankle replacement? So yeah, you have to trust. It's a lot of trust when you have someone that's going to do a surgery like that, and you're counting on it turning out good, or you're not going to be walking. So yeah, we did develop a good relationship, and when I go for my checkups and so forth, he's very good with it and lets me know everything that's going on.
Yeah, that is wonderful.
Yeah, he's a great person.
Dr. Juliano, let's talk about the advancements. Where do you see ankle replacement surgery in the future?
Yes, I think it's come a long way from the Agility, which was the first one.
Mm-hmm.
And in that particular implant, you had to get the two bones to grow together to stabilize the implant. Now, you just put the implant in under the tibia, and it works pretty well. But now we have patient-specific implants, and we actually have ones that you do a CAT scan, and they do a three-dimensional cutting guide, so it makes it more precise. So that's very good for reproducibility for other people to do the ankle replacements as well. And then in the field of foot and ankle surgery, there's a lot of advancements in minimally invasive surgery, mostly for bunions and things that we've understood, the three-dimensional aspect of bunions. In the past, we lived in a two-dimensional world because of x-rays, but we're getting there. And lots of different things for cartilage implants, and if you get arthritis early, but when you have end-stage arthritis, it's either replacement or fusion.
Well, thank you for what you're doing. You're certainly making a difference. For Bob, I mean, a huge
Absolutely.
difference. And it's amazing how you're able to do this and that you're able to get around and walk so well.
Absolutely. I can move it, and it's just great.
That is great. Thank you both for being with us this evening.
My pleasure.
Thank you so much for having us.
And you're welcome. And if you would like more information, or if you would like to make an appointment, you can call this number 717-913-0163, or you can visit online at pennstatehealth.org. Now let's check in with Donna Kirker-Morgan. Donna, what are some of the questions being asked tonight?
Deborah, we've had a wide range of questions coming into the web chat, and Dr. Sarah Black, foot and ankle orthopedic surgeon at Penn State Health, has been busy this evening. You've been typing away, a lot of questions since 7 o'clock. Now, our first viewer is asking this: what are the most common types of foot and ankle surgery?
So that's a great question, Donna. So one of the things I love about foot and ankle surgery is the diversity of the types of procedures I get to do. So I commonly will fix ankle fractures or sports injuries like ankle sprains or Achilles tendon ruptures, but I can also help patients with their bunions or do a big surgery like an ankle replacement like Mr. Hershey had.
Oh, it's interesting about bunions. I think a lot of women, because of high heels, suffer from that. Is it still a 6-month recovery from bunions, or are they getting better at that?
So it's a much quicker recovery now. Some of my partners and myself perform minimally invasive bunion surgery, so it's a much quicker recovery now.
This viewer is asking, how is ankle ligament repair done?
So a lot of times ankle ligament repairs respond well, or ankle ligament injuries respond well to physical therapy. If they don't get better with physical therapy, we start with putting a camera in the joint with an arthroscopic procedure to look at the overall health of the joint and the cartilage, and then we make a small incision on the outside of the ankle to repair that ligament with some strong suture.
That is fantastic, and it sounds like it's just improving and changing all the time.
There's lots of innovation going on in orthopedics.
Now, if you have a question for Dr. Black, you can go to abc27.com/orthro, and she'll be here until 8 o'clock. We're going to return a little bit later with more questions with her. In the meantime, we're going to take a break.
You're watching Bodies in Motion, Orthopedic Health on ABC27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Rob Gallo, orthopedic surgeon with sports medicine at Penn State Health. Thanks for being with us. So what are some of the most common sports-related injuries?
So it really depends on age. So when you're younger, so you like the teens and the 20s, you typically tear ligaments, and as you get older, you tend to tear tendons. So when you're younger, like anterior cruciate ligament injuries and patellar dislocations in the lower extremity, shoulder dislocations in the upper extremity, and then as you get older, it becomes like the rotator cuff tears and the quadriceps tendon tears and pain.
So are there any sports injuries that are related to any of these?
Yeah, so each sport kind of has its profile of the things that are commonly affected. So soccer's a real big ACL sport. Basketball is ACL sport. And then a lot of the overhead sports wind up having more shoulder problems.
So when this happens, I know if you're injured when you're playing a sport, you're thinking, okay, I need to put ice on it, I need to rest. At what point should you say, no, I really should probably go and make an appointment?
So when you have an acute loss of function, for instance, so you're playing basketball, you land funny, and then you felt a pop, things swell, and you can't walk on it. Something like that, you probably should be seen sooner rather than later. So that's the one you go to the emergency department for. If it just kind of is a chronic aching sort of pain, that one often you can wait a little bit, and oftentimes that'll get a little bit better.
And so if it's something where you do feel like, oh, I should probably go, how soon should you go?
You should probably go sooner than later, because sometimes it's hard for us to decide a fracture unless you actually get an x-ray. So I would urge it, if it happens acutely, you should go that day or the following day.
So now let's talk about the latest treatments as far as helping some of these injuries.
So it's a constantly evolving field. Some of the exciting things that we're doing now involve biologics, and I think you hear a lot about stem cells and platelet-rich plasma, PRP, and those have offered some promise and are still really being developed. I think there's even more exciting stuff with biologic along the way, and as we learn more about genetics and the interaction of different hormones and chemicals, sometimes that'll offer some great new modalities for treatment.
Yeah, that does. I mean, that sounds very exciting.
Pretty cool stuff.
So how do you really help the younger athletes? I mean, when they have injuries, how do you get them back to playing or doing what they love doing?
So I think one of the keys is to try and prevent them. I mean, that is a big part of it. And as we see these travel teams arise, I think it's, as a parent, one of the big things is to just make sure that they're not doing too much of the same sport all year round. Baseball, there's probably, if you're a pitcher, you should probably take a couple months off. And then the other thing with that is to make sure you're doing the body maintenance that you need to do. So with pitchers, their shoulder blade's a big issue. Or lower extremity athletes like soccer players, you need to keep your quads and your core strong. It's not about just going out there and playing, it's doing the prep before and after.
Yeah, so definitely taking some time off, because I know with sports these days, they're almost year-round sports.
And you kind of get caught in the whirlwind a little bit. Everyone else is doing it.
Absolutely. So let's also talk about now chronic conditions like tendonitis or cartilage damage. What's done for that, and what's recovery like?
So typically we try non-operative modalities first. So physical therapy often is really effective in managing these. And if that doesn't work, sometimes injections or other injections such as steroids or the platelet-rich plasma that I talked about. And really surgery is usually a last resort unless you tear a tendon or you chip off a piece of the cartilage that's floating around. Because the surgeries for that are pretty unpredictable. And generally in orthopedics, we like 90% good to excellent results. And some of those surgeries are a little bit less than that.
And some final advice for people who are like these weekend warriors who are like, okay, I'm going to go and run a 10-mile race, but I haven't done any training. How can you prevent injuries? What's your advice?
So I would slowly ramp that up. As you get older, things aren't as elastic. Sometimes your bone density is a little bit lower than it was when you were younger, and bad things can happen. So slowly, gradually work your way up before you do the 10-mile run.
Good advice. Dr. Gallo, thank you so much for being here.
Thank you, Deborah.
And if you would like more information, or if you would like to make an appointment, you can call 717-913-0163 or visit online at pennstatehealth.org. And let's check in with Donna and get some answers to more of our web chat questions. Donna.
Thanks, Deborah. Back with us is Dr. Sarah Black, foot and ankle orthopedic surgeon at Penn State Health. And she's been busy tonight answering questions. The first viewer question I'm going to send to you now is, what are the surgery options for a torn Achilles?
So a lot of Achilles tendon ruptures actually don't need a surgery. They respond really well to conservative measures like physical therapy. Sometimes for really high-level athletes or a really active person, we'll do a surgery. There's different techniques to do that. Some people do it through a bigger open incision, and other people use a more minimally invasive technique. But either way, you're passing big sutures through that tendon to help get those tendon edges back together.
So talk to your doctor about those different options. This other viewer is asking, I run a lot. Could I need surgery for chronic heel pain or stress fractures?
Yeah, so chronic heel pain, the two most common things that come to mind is a stress fracture, like you mentioned, or plantar fasciitis. Both of those things are things we typically don't treat with surgery. A plantar fasciitis responds well to physical therapy and stretching, and a stress fracture responds really well to just rest and optimizing your vitamin D and calcium.
I like that option, rest. And what's involved, this is another viewer question, what's involved in foot surgery for arthritis? or joint damage?
Yeah, so there are a lot of different joints within the foot and ankle. So some of the smaller ones we can treat with removing bone spurs or fusing them, where we remove the cartilage from the joint and make those bones actually grow into one bone, and it really reliably relieves pain. For some of the bigger joints, we can perform an ankle replacement like Mr. Hershey had.
And I want to thank you so much for joining us. Now, Dr. Black will be here until 8 o'clock tonight. So if you want to still get a question in, go to abc27.com/ortho to submit that question. In the meantime, we are going to head back to the couch with Deborah Pinkerton.
And thank you, Donna. Joining us is Dr. Aman Dhawan, orthopedic surgeon with sports medicine at Penn State Health. Thank you so much for being with us tonight.
Thanks for having us.
Let's talk about ACL injuries. And when someone tears their ACL, how do you know that it's more than just a sprain?
Yeah, ACLs can be devastating injuries, as you know. If anyone that's had a child or a friend that's had one, they can be pretty difficult to manage and with a fairly long recovery. They're different than other knee injuries, and one of the first things that you can sense when you have that injury, about 70 to 80% of patients will experience a pop, feel or hear a pop. They'll have fairly immediate swelling. It'll be difficult to ambulate, it'll be difficult to walk, difficult to continue playing the sport for which that they sustained injury in. So if you have any of those signs while participating in any activity, whether it's skiing or basketball, what have you, it's a good sign that there might be something more wrong.
So let's talk about treatment options.
So ACL reconstruction is kind of the be-all and end-all treatment for ACL injuries. And in part, it's because the ACL as an anatomic structure, unfortunately, does not like to heal on its own. If you are a relatively sedentary individual and this happened to occur while slipping on the ice or coming down some stairs, you may not need ACL surgery. And if you have a lifestyle that basically engages in low impact cardio and walking, maybe some weights, you might not experience the instability or problems that people with ACL insufficiency experience. But for anyone active, including weekend warriors, which most of us are, the ACL is a very important part of the anatomy of the knee and the physiology and function of the knee. And it's that ACL that protects all those other structures in the knee, the menisci, the cartilage, all the other things that if the ACL goes, then there goes those other structures. And so it really behooves people that are active, even if they're weekend warriors, as I said, you really should think about getting an ACL reconstruction.
So let's move now to the shoulders, and let's talk about labral tears in the shoulders. How do they really differ from other injuries?
So, the shoulder is a very complex joint with a multitude of structures that can get injured in a active individual. And the two most common that you hear are the labrum, which is kind of the cartilage grommet in the shoulder that sits around the glenoid, the cup, and helps provide stability to the shoulder. And then the rotator cuff, which is essentially a tendon, which helps in the function of the shoulder. Both of them are very important structures. The labrum tends to be an injury that occurs in a younger population, not exclusively so, but tends to happen more in contact sports or overhead sports, athletes that participate in things like baseball, tennis, volleyball, or contact sports like hockey, wrestling, football. And the labrum, it can be very vulnerable in those types of situations.
So let's talk about treatment options.
So treatment for labral tears should be individualized. One thing I think we pride ourselves at Penn State Health is, we do a lot of surgeries for all these things, labrums, rotator cuffs, ACLs, and we really try to engage in a very individualized approach. It's not a one-size-fits-all, and I think that's what's helped us, all of us, provide such great care and such good outcomes. With a labral tear, it really depends upon what their sport is, what their activity is, what they were trying to get back to, their age, things of that sort. And there's a multitude of different surgical options that can be offered to those patients. And then additional surgical options if they happen to be for instance, a collegiate level athlete or a professional athlete or someone that may be putting themselves at more risk than others. And so these are the types of things that I think we nuance while we're working a patient up, seeing them in the clinic, and then preparing them for surgery.
So everything there is all under one roof, and that's what makes your team so special.
Agreed. And there's a lot of people behind the scenes that, you've seen 4 great members of our team tonight, but there are so many people behind the scenes that help us all. And I think it's this conglomerate of individuals and people that functions as a 1 + 1 = 3, and we really can provide outstanding care and outcomes for our patients.
Thank you for what you're doing, and thank you for being here this evening.
Thanks for having us.
And we send a special thanks to Bob for sharing his story, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to make an appointment, you can call this number, 717-913-0163, or you can visit online at PennStateHealth.org. We want to thank you for watching tonight. Be safe when you're out there playing sports. Tonight, we wish you good health.